just said a bad word at the beginning of that?
I don't think so.
Okay, good.
Is it?
Let's see. I think
Is
it's
it
going. We'll
good?
see if people show up.
Meeting in the brain.
I know. So funny. Usually we have little bubbles show up. See if you can see. Oh, good. I didn't say a bad word at the time. Oh, there we go.
There
Hi,
we go.
Michael. All right. Oh, our little bubbles are coming. Yay. Our people bubbles. Who are you calling a lady, Michael? Hi, Tom. Yay. Look at this. Good times. Hi, everybody. We're going to wait just a bit to get everybody settled in. We know it's afternoon. Hopefully you're skipping work.
We
to
are.
watch us, because we are. We hope we haven't thrown you off too much because we have switched sides. And we are also, oh, hi, Dr. Norman. We have Secretary Norman. This is where we get so excited and nervous. Yay.
We're famous.
Yay. But we know there's a lot of questions out there. There's a lot of stuff happening right now, so we're going to wait just a bit to get everybody in here. I was saying we're on opposite sides for the first time. Please, we'll introduce ourselves again just in case that
Just so you
throws
don't
you
get
off.
us mixed up.
Yeah, people confuse us all the time. And we're at the health department today because the hospital is still open and we didn't want to accidentally show people walking by. Yep. Look at us. We're so thoughtful these days.
We are.
I tell ya. Health department people these days. So good. Alrighty. So it's 1 after 4. Oh, there's Dr. Joyner. Yay. I think she's still at a beach. So thanks for joining us. All right, you guys, we're going to get started. So I am Jen Bacani McKinney, and I am the Wilson County Health Officer.
And I'm Destiny Wheeler, and I'm the Health Department Administrator.
All right, and here we are again today. We're doing these every 2 weeks just to keep people updated. And today, you know, I think there's a lot of things that we have to talk about. And so please, as we go along, we're watching Destiny's phone for questions. So please go ahead and post them. We will try to catch everybody's question. We just want everyone to be informed. That's been our job the entire time, is to let you know what we know. If we don't know, we will find out for you, and we'll do our best to keep everybody informed. We're all about transparency. This is a time in the world that we've never experienced before, and we know it's scary for people. And so the best that we can do to keep people informed, that's what we're going to try to do. So thank you for being here with us.
Yes.
Des, do you want to start with cases?
Let's start with cases. My pen. In Kansas, we are getting updated 3 times a week. So these numbers are from yesterday. In Kansas, we had 12,465 cases with 259 deaths. That's a bigger jump than we generally see over the weekend. We have been seeing approximately 100 cases a day, and that's a 400 case. There's a 400 case jump over the weekend. So that was significantly more than we've been seeing. We are still setting at a percent positive testing rate of 8. That means of every 8%. So of all the cases that we've tested, 8% of those have been positive. So,
and those are important numbers because, you know, people talk about, well, as we test more, we're going to have more higher numbers, right? And that's exactly right. But if we look at the percent positive versus the absolute positive numbers, meaning like the black and white numbers, if we take that percentage, we'll be able to compare that to what we've been seeing before.
Yeah. So it shows that our growth is about the same. We're just catching more cases, really. And then our fatality rate, our death rate, is still sitting right around 2%. So in Kansas, national numbers, we have 2,302,288 cases as of today from CDC, and 120,333 deaths. So that's about a 5% death rate, in case you were curious. And
just as a reminder, the way that we calculate those death rates or case fatality rates, it's all about the number of people who die because of the disease of COVID divided by the number who test positive. And so, again, we know that these numbers, even in influenza and other things, we can't know every single case and every single cause of death, but that's the best information that we have at this time. So we're trying to use the data that we have always.
Yep. And Heather, I see your question about Casey's, and I promise that is on our list. We definitely have seen the chatter and have been working on that.
We actually placed bets earlier on how long it would take for someone to ask about Casey. So in a moment, you'll see Destiny make it rain because I think I won the bet. So can we say make it rain?
Yeah,
okay.
I think we can. If I had any money, I would do that. But I work for public health.
Well, we'll talk about that later. All right.
Okay. I'm just kidding. Okay, so I did want to bring up, we talk about the more cases, or the more testing we do, the more cases we see, and that's true, but we want to still make everyone very aware that coronavirus, this novel coronavirus, is still circulating, and especially circulating in this part of the state. We're seeing much higher numbers than we had been in the past. So I took our surrounding counties and I kind of looked through their news releases and kind of broke down their numbers and stuff. And Labette County to date has had 28 cases, which is on the higher end. Neosho County, this is one I wanted to particularly point out because they are our next door neighbor. They have 17 cases to date. They had reported 5 recovered cases and 12 cases from one gathering. They were all linked to the same gathering. So yes, they only have 17 cases, but they got those last 12 cases in the last 2 weeks, and they were all from one specific gathering. And so that's why we keep talking about wearing masks and social distancing and cohorting and being around the same people over and over, because the more we spread out and the more we get into bigger groups, the more likely we are to see these bigger numbers.
All right. And I do think, we don't, like, we're going to talk a lot today about these numbers going up, and that's why we're presenting our neighbors' numbers, because it sounds great to have like one recovered case in Wilson County, but that doesn't tell the whole picture. County lines are invisible. We make these things up, and so there's nothing keeping the virus within those county lines. So when we talk about gatherings, when we talk about wearing masks, it's really because it takes one gathering to jump our numbers from essentially 0 to 12 or whatever else. So on one hand, we know where all those cases came from. That's good. We can contain that, hopefully, but in the other case, that's a lot of people, and we know if we're talking about a 5% death rate and we have 12 people, those aren't numbers that we like to hear.
Yep. So Montgomery County, our neighbor to the south, has 25 cases to date. Woodson County is hanging out at 6. Greenwood County had a bit of a spike, and is up to 11. And Crawford County I bring up because they actually got 53 cases in a day. And then the next day they got 33 cases, or I guess it was 33 cases one day and 53 cases the next. They're up to 192 cases, and they are bigger than we are, so there are more people moving around, but the majority, I think, of their cases surround, again, a factory. So those people working shoulder to shoulder and doing those kind of things all day, every day, those are the types of situations that cause this to spread more readily, as any virus. If you have a cold and you work right by somebody, that's what they're going to have too. So.
And we stress, if you're sick at all, if you have a cough, if you have a sore throat, even if you're like, this is when I have allergies, like we all are fighting allergies right now, but if it's anything that is out of the ordinary, always check with your doctor to see if there might be more going on, because we just don't know. And we know there's asymptomatic spread also, right? Or pre-symptomatic spread, and we kind of talked about that last time. But we really want to emphasize that if you are even a little bit sick, or any of those symptoms we talk about, fever, sore throat, cough, shortness of breath, lack of smell or taste, those kind of things. If you're nausea, vomiting, diarrhea, I think we're still talking about that too, right? Anything,
So if any part of you is not working like it should
yes, be. Yes. I don't remember seeing that hair before, Des. I think that's out of the ordinary.
That's because my dye ran out and it's gray again.
No, so if there's anything out of the ordinary, we want you to check with your doctor, because that could be it. And you, in staying home, in staying home and in getting yourself tested, you could be saving other people's lives, and that's an important thing to note here. So please, we know we harp on these things a lot, but we do it because we know that this is the only way we have to save lives at this point, is protecting each other, wearing masks, social distancing, and all that.
Yeah, and so then I kind of looked at some of the state numbers around us as well, and I got, we know from some of the articles that have been circulating around Facebook that Oklahoma just had their highest one-day jump, and they are at 10,545 cases now, which is significantly more than they had. Arkansas is at over 16,000 cases, and particularly Northwest Arkansas has a large outbreak right now, so that's our neighbor. So
And that's
it's
the cool
right
part of
down
Arkansas
there.
too.
Yeah,
It's
that's
too bad.
part. Yeah, and then Missouri, we're a little over 18,000, or they're a little over 18,000, and we know that Joplin is having a big spike right now. Again, not that far from here. And actually, they found a human scalp in a park in Joplin. So
That's some messed up stuff.
that's another reason to not go to Joplin right now.
No offense to Missouri, except that it's Missouri, and we'll be offensive if we want to be. Sorry, neighbors.
Colorado, we know, had big outbreaks earlier in the pandemic, so they're a little over 30,000 cases. And Nebraska, our neighbor to the north, is almost to 18,000. Not quite there yet, but yeah. So.
Now we do know that the death rates, I think you have the death rates calculated. We are kind of in the middle. There's some that are below 2%, some that are above 2%, and so again, these are significant things. Just knowing that like, for example, Oklahoma is seeing sorry, I know we love Joplin.
Well, actually,
too.
I like Joplin too.
But knowing that the state just right next to us, where we know people, we all know people who are still going to Oklahoma, who are still going to Joplin. We want to make sure that everybody is safe, and so we, knowing that they're so close by, it's not to say like that they're doing anything wrong, that anybody that travels there is doing anything wrong. That's just the facts we're dealing with, is that they have more cases than we have at this point. So
yeah, it's likely that people in Joplin are doing the exact same things that we're doing here. They just had the disease there first.
True. And how about Branson from Julie?
I didn't
Not specifically.
I didn't look specifically into Branson. I know that they're doing a lot of different things through Silver Dollar City to increase social distancing and stuff like that. But other than that, I really don't know. I just know that it's been in the news that Joplin's having these larger spikes, bigger numbers. So yeah.
So those are our numbers, and please, again, keep asking questions, and of course, Jason, we know it's not a laughing matter, and we do love Joplin, and we, I think most of you who have been on here with us before know, we do make jokes, just about, not about, we definitely don't make jokes about deaths, we don't make jokes about disease, but we do try to offer a little bit of levity to the situations. We make fun of each other a lot, and we make fun of ourselves a lot. And we do make fun of Missouri sometimes, and that's still, I think that is still fair game. And you know.
But no, and yeah, it's just, yeah, we weren't making fun, I promise. We understand the severity of the situation.
So I do have to say hi to my little patient Ren, who said hi, Dr. McKinney. She's my little clone. I guess maybe we should. Yeah, we'll address Casey's now. I mean, because I know that's a kind of a big topic here in Fredonia.
Yeah. So Jennifer and I both noticed last night on Facebook that there were a bunch of people saying that Casey's was closed and speculating. And speculating that, it was because of COVID and there was an employee with a positive case and all that. So we don't know the exact details yet. We've been working with a couple agencies outside of the county, within the state, but outside of the county, to kind of help us get to the bottom of this. We're not 100% sure, but we do know that Wilson County does not have any more positive cases. We are 100% sure of that.
So, and that means Wilson County, people who live within Wilson County, right? So they could work here, they could be traveling through and get tested here, but residents of Wilson County, there are no new cases.
Right. So it's our understanding that Casey's just shut down out of an abundance of caution and is cleaning their facility. They have a contract company that comes in and cleans for them, and honestly could be opening up soon. They take several hours to do it, and they have a whole protocol that they follow, and so we are going to continue to try and figure out exactly what is going on there.
And we try not to present information without knowing all the facts. And so please never mistake any lack of information or just spreading the word with us trying to hide anything. And again, if you guys have been watching us or have ever talked to us, we probably say too much, really. But we want to give you accurate information. We want to give you accurate information one time and one time only, right? So that's what we're trying to figure out. And rest assured, Destiny and I have been working on this since late afternoon yesterday. This turns into evenings working on this, which turns into mornings working on this, and so we're trying really hard. It's harder than what people think to just call people up and find out information, and we also have to work within the confidentiality laws as well.
Yes, yeah. So it's
not easy.
It's interesting. It really is very interesting, though. It's if it wasn't here, it would be one of my favorite parts of public health.
So we're going to continue. As soon as we get more information, we will let you know. But we do know that Casey's did a great job, as they should have, of really just saying, hey, if there's a possibility, let's get everything clean and figure stuff out and keep people safe.
Yeah. Oh, go ahead.
Oh, I was going to say, so we have both received, and the health department has received lots of calls and texts and questions about, is something going on with Casey's, and I was there the other day and I got a drink or whatever else. The first thing we would say is that remember that there are guidelines of what a contact is. So if you went in there and you got a drink and you left, and most people are there a couple of minutes maybe, odds are good that you're fine, right? Because unless you licked a countertop, which you should never do, ever, any countertop for that matter, then otherwise you probably should be okay. If you hung out there because you're like a Casey's groupie, also always a bad idea. These are just life lessons. And then the other thing we would say is, please let this be kind of one of those practice runs of, if you are concerned enough to reach out, am I exposed, am I not exposed? Hopefully you're concerned enough to be wearing a mask also, because had everybody there been wearing a mask and the people going in and out been wearing a mask, we would have lots of less risk of being exposed and spreading the disease. So again, hopefully everybody's going to be fine with this, but hopefully this perks up our ears to say, hey, it's still here. We can encounter it in everyday life. I just wanted a donut, but instead I got scared. So please let that be a reason that we decide to wear masks and again, watch out for each other and protect each other.
Yeah. We've had a lot of people say, I have asthma and I went in there, I'm diabetic and I went in there, and yeah, we really need to continue to think about where we are, be very aware of our surroundings, wear our masks, and one thing that I want to be clear on is the definition of contact, because we used to talk about it a lot, but we don't talk about it a lot anymore necessarily. But being a contact is you are within 6 feet of a positive person for 10 minutes or more.
Not just a positive attitude. Sorry. Okay. Again.
So let's say, just for instance, this is not the truth, but let's say for instance, the clerk at the front of Casey's had COVID-19. If you go in there and you get a donut and you go up and you check out with your donut, and then you walk out, you are likely not going to be a contact because you weren't there for 10 minutes. Again, like Jennifer said, you want to lessen the risk even more. Both of you wear masks, and it's so much better. And there is a comment.
Yeah, and thank you, Jason, for pointing out that not only is it important to wear a mask, but to wear a mask properly. It should cover your nose. It should come down below your chin. You know, we see a lot of people where it's down below their nose. I saw a comment on Facebook that, did you see that?
I did, but I don't think you should say it.
No, okay, I won't say. Man, voice of reason. Okay, maybe next time, everybody. But yes, always, because our, what I affectionately like to call our nose breath, still can transmit droplets, and so I don't know if that's a thing. But and Jessica, you asked if the workers were wearing masks there. We don't actually know at this point.
I don't know, no. I always wear a mask when I go into Casey's, and I think they have, did they have a shield?
I think they have plexiglass.
Yeah, they have a plexiglass shield, so that helps, but I don't, sometimes I see masks and sometimes I don't. So it would be great if they were wearing a mask, but the plexiglass shield does help a bit.
Yep. And while we're on the topic of masks, really, there is a big study, and there are a lot of studies coming out. And you guys, like, this is kind of our job also, is to go through these studies and say what you should be listening to at this time, and what we are kind of watching. So there's a lot of that out there. We're trying to figure out what's going to stick and what's not. You know, there's small studies, there's big studies. Right now, one of the biggest things that we have found in research is that masks are really, truly one of the the best way to decrease transmission of coronavirus. So social distancing, yes, but social distancing plus masks is really, really the best way to be decreasing the risk of coronavirus, or transmission of coronavirus. So please, you know, we've been pushing that a lot, but please know that it's not just because we want people to, you know, do what we say. It's because that's the research. Even if you remember early on, we were like, no one should wear masks. But this is how science works, right? As you get more data and you get more research, then that's how we form ideas and we form recommendations. And so that is why we keep kind of harping on this. And other people, you can see on the comments, are really hoping that people wear masks, because it's also protecting, it's mostly protecting others, protecting them.
Yes, yeah. And Debbie, I would suggest hand sanitizer. She says, what if, you know, you check out with your donut, the clerk touches the donut bag, and then you go eat your donut, or you touch the money or whatever. And hand sanitizer and hand washing, so important.
And that's even before coronavirus. Don't touch your money and then eat a donut. You should always wash your hands, because money is dirty even without coronavirus.
Yeah, and or pay with a debit card, and then you still have to touch the same pad everyone else touches, but again, wash your hands, and really that is the best.
And we did at some point in the last month or so get information to say that it's less likely to be transmitted, like droplets to surface and then surface to you. It still can happen. It's more likely to be droplet to the person, right? Mm-hmm. But it still is all about those droplets. So you go in and somebody coughs on something, and that's another important point is when we're talking about contact, if you are only near somebody for a short amount of time, but you're in close contact, they're coughing, they're sneezing, and their droplets get right on you, you do not need 10 minutes of coughing on you for that to be contact. That's just straight up contact. But we're talking about, like, nobody's coughing, nobody's sneezing, you're just in the same area within 6 feet. It needs to be for 10 minutes at a time, and that's where we call it a contact. And then still, a contact of a contact is not a contact.
Yes. So if, again, we'll just use Casey's because that's a good question. We'll use Casey's because that's what we're talking about. If I work at Casey's and I am working, and I'm sorry,
which you should be doing.
You should.
If you're working at Casey's.
You earn that money, but if I am exposed to Jennifer, who has COVID, then I go to work, I am a contact. But the coworkers that I work with, they're contacts of contacts. So they're not associated with Jennifer's positive test. So we do that a lot. I have the contact of a contact is not a contact shirt, and we very literally say that daily in this office. Daily. Okay, so a contact of a contact is not a contact, and
sometimes we get phone calls of a contact of a contact of a contact of a contact.
Yeah.
And that's okay. Like, we want to help you work through
yes,
that because
we are happy to do that.
It's very tricky, this whole thing. It sounds very simple when we say it like that, but then like who then has to quarantine versus like Destiny's talking about those coworkers. They might still want to watch themselves for symptoms and just be sure and watch what's going on with Destiny.
Yeah, and if I am a contact and I start developing symptoms, then that actually does make my contacts.
If you become positive, right?
If I become positive,
Mm-hmm.
yes.
Yes.
If I get symptoms and get tested and become positive, then they are my contacts. So
Yep. So, ooh, that's a lot of contact stuff, right?
yeah.
So there were a couple questions. Should you change your mask each time you go out? Ideally, you are washing your masks like every day. So let's say you go to the grocery store and you wear the mask. If you then like go home and then you're like, I gotta go to the bank, you could wear that same mask and it would be fine. We're just saying at least daily wash your masks, and that would be the best thing. And just wash them in the washing machine.
Yep.
No big deal. Is that about right? Someone else asked about if N95 masks are readily available. So the beauty of this whole flattening the curve thing, right? Like, we were all like, what does this mean? Like, back in March, nobody ever used social distancing terms, flattening the curve terms, and now it's like part of everyday language. But the beauty of that is that we were able to flatten the curve, at least especially in our rural areas. So we are at this point where we do have more masks and we do have more testing and we're more prepared for patients with coronavirus. So now, are N95 masks readily available? Not necessarily. I think they are more available these days. So some people are getting them like at the hardware store even still, or ordering them online. And it's fine. We still want to try to reserve N95 masks for people who are in healthcare, simply because if we do have a spike coming, we still have limited supplies at our hospitals, at our clinics, at the health department, and we don't want to run out of those masks. So for the general public, not that we don't want people to be protected, we want people to be protected, so we want everyone to wear masks, but not necessarily always N95 ones.
Yeah.
Oh, for the average person who has an N95 mask, do they have a limited life expectancy such that they become less effective over time? Great question, Michael. So I feel like that's one of those like where you're quizzing me, but I'm just kidding. So back before coronavirus, when we were like, this is America. We've got all the gloves and masks that we could ever want. Pass me some more. So we used to, that was our attitude before. But nowadays, we know that supplies are limited. We experience that and have never experienced that before. So we do allow people, before we would use it once for one patient and toss it. Use it once, toss it. Like, again, the American way. That's what we do. But now we know that it is safe to use that N95 mask multiple times. If it becomes soiled, if you get kind of spitty in it and it's like wet or gross, or if you get anybody else's droplets on it, then you shouldn't continue to use it. But in general, if it is keeping up its integrity, then you would go ahead and keep using it. And mostly because we don't want to run out of those supplies. So hopefully, does that answer it okay?
Yeah.
All right. Thanks, Dr. Sevilla, for being here. Question about summer activities. The swimming pool has lots of chlorine, no mask here. Are we safe?
So, as a general rule, outside, if you can socially distance, you do not need to wear a mask. The odds of spreading the vaccine are much, much lower outside.
Not vaccine, virus.
Not virus, not vaccine. The virus are much, much lower outside. So, it is absolutely never recommended to wear a mask when you swim, ever.
Unless it's a snorkel mask.
Yeah, like that's fine. But as far as
Face mask.
you don't want, that's totally dangerous. We don't want that.
And no one under age 2 years old also.
Right. Yeah. So it's
And you're asking, are we safe? Yes, I do believe that we can be safe almost in any in any setting at this point, right? So we are opening activities like sports and like summer arts and all of that stuff. But the trick comes with how we're regulating that as we do these activities. So we know that life has to resume. We're not going to stay in lockdown forever. And so are we safe? Yes. But if there are 100 people at the pool and nobody is social distancing on the sides and we're all, at picnic tables together, shoulder to shoulder, maybe not the best time to go to the pool, right? But yes, chlorine will kill the virus when you're in the pool. That's fine. But in general, people don't stay in the pool the whole time. We have breaks. We have, people get out to eat and all that. So we use the restrooms and everything. Hopefully not in the pool. They say to keep the pee out of the pool. As in an ool. Sorry. Oh, I'm done. Okay.
But no, I think there is definitely if you're aware of your surroundings, if you are taking those social distancing precautions and things like that, then you are relatively safe. There's always a risk. Don't drink the water to kill it. But yeah, there's. We don't all need to live in fear, but we all need to be aware of the risks.
And the more we can do that, the more we can social distance and take those precautions, then we should continue to be able to do these activities and keep each other safe while doing them. It is when it's more likely when we are in these big gatherings and all this. People had hoped, hey, is the summer weather, like the heat, is that going to be better for this virus? Is it going to be better and we won't be transmitting the virus? We're finding that the answer is no. Here we are in the middle of the summer and we're still seeing cases go up and these gatherings, maybe they're outside or maybe they're inside, they're still not 100% safe. But if we can do things outside versus inside, that's even better. We know that's a little bit safer for people not being enclosed in one area. So lots of precautions that we can take.
Yeah, Teresa, that is a really good question. As long as your toddlers are over 2, it is best for them to keep masks on when going to church and the library and everything. I couldn't even get mine to keep a barrette in their hair, so I don't have any great tips. Rub peanut butter on the inside. Just kidding. Just kidding.
We're going to give you terrible tips. If we give you tips, it's just going to display how terrible our parenting is anyway. So,
no, I was kidding about the peanut butter, but I really maybe get them really cute masks.
Yeah, we don't know. It's hard, and there's nothing about being a 2-year-old, like a 2.5-year-old, that makes it easier than a 2-year-old. Really, the way that children breathe when they're younger, that's the whole idea behind whether they should wear a mask or not. And so we don't want to stifle their breathing, and because they're so young, they tend to be mouth breathers, I believe. And so that's the whole idea. It doesn't get easier once they're 2 years and 1 month, or even 3 years, or 4 years, really, for that matter. So it's hard. We know. We try our best, and we're trying to be realistic with everybody.
Yeah.
I know Diane mentioned earlier about Cultivate Fredonia and Sausage Fest, and it's true that we are canceling Sausage Fest for this year. It's an outdoor event, but we also know it brings a lot of people together, so we just want to make sure everybody stays safe, and we're going to have it next year. It'll be the 5-year anniversary, and so it'll be great next year, bigger and better. Sausage Fest. I just thought I'd bring that up. Okay.
Yeah, no.
Oh, the other thing, dexamethasone. So as we are trying to sort through all the different studies and news articles and everything, and we read a lot every day. There's a lot of information out there. So one of the treatments that's out there is dexamethasone. So if you've ever come to see me and you had allergies, I might have given you a shot of dexamethasone if it was really bad. Or if you've had poison ivy, that might have been something that you've gotten an injection of. So it's a very common steroid. Now, early on we said, do not use steroids because it's bad for coronavirus. It's not going to help anything. Now, like we said, as we gather more data, we find that maybe this one steroid could be good. It has only been studied in people who are severely ill. So in the hospital, like in an ICU, they're showing that it could decrease like the length of time that the patient is ill. By no means is it going to be something where we would recommend it to anybody outside of an ICU, pretty much. So, but just something, I know people are wondering about that kind of thing. and treatments. I know they're still giving out an antiviral called remdesivir. That is something that people are getting regularly, and we're still looking at those studies and seeing if that's going to be a good treatment. So another thing that came up in the news is whether or not we produce antibodies. So we're all anxiously awaiting this antibody testing that people keep asking about. Well, one small study, and again, this could change when we talk to you next, but one small study said that in people who were asymptomatic, most of them did not build, I guess, antibodies or create antibodies to the coronavirus, or if they did, they were not long lasting. And so this is kind of a downer, right? Like, that's a bummer, because we're waiting on seeing if we're going to all be immune and we can have herd immunity with exposure, a combination of exposure and vaccines. But again, this is a small study. We're waiting to see if this ends up being a good study or not. But we bring it up because there are scientists out there doing so much work to figure out what is the true information. And there are scientists out there producing these tests and testing these antibody tests and trying to figure out when we can rely on them and be able to give you the information effectively from an antibody test. So we are waiting and seeing. We'll find out later what that looks like.
Yep. Masks for asthma?
I've heard things on other people with asthma should be wearing masks or not. Which is it? Really, if you have asthma, you probably should still be wearing a mask. If you are having any trouble breathing, maybe that's not a good time to be out and about anyways. So really kind of just be careful with that. We don't want to hurt anyone. Asthma, COPD, emphysema, those are all chronic lung diseases, and we don't want people to make it any more difficult to breathe, especially if it's hot and humid out. So still, if you're going to be out and about and you have controlled asthma, you probably should wear a mask. But if you're having any type of flare-up of those chronic lung diseases, then that's probably not the time to be out and about anyways. There were two questions about rubella and then MMR.
I've not heard anything about MMR. The question is, read something about MMR vaccine providing some protection too. Any thoughts? I don't have any thoughts because I've not read that.
So we will definitely research that for you, because it looks like there were two questions on MMR, and then someone specifically mentioned rubella, although rubella vaccine only comes in the MMR at this point, I believe. So
in the U.S.
In the U.S. anyway. So we will get more information for you on that one.
Yeah.
What else? Any other questions? We like to try to keep it short and sweet, because we're very sweet people.
So easy for us.
Yes. But we do want to allow you guys to ask any questions you have. And of course, like we always say, this is not the only means to get answers. We will always try to help out with getting you answers. So we really, really, really want to stress that this is not the end of anything. This is not business as usual. This is where there are we in Wilson County are in phase out. There are some counties that are still they still have restrictions. The state, Governor Kelly, recommended that we stay in phase 3, but we are already, as of last week, out of phase 3. And so we want to make sure that just because we don't have all those restrictions that we had before does not mean that the virus is less infectious or contagious. It doesn't mean that people are necessarily dying less. I mean, we're getting that data to see what the actual rates are, but it doesn't mean that the virus has changed in any way. It doesn't mean that it's spread any differently. It doesn't mean that social distancing isn't important. So we need to keep doing those things, especially now when we all kind of feel like, finally no restrictions. But there are still ways to protect each other.
Yeah, and I read a thing the other day, and I thought that it was very simple, but well thought out, or like was true. That so we flattened the curve, so now there's room for you in the hospital.
Yeah, and it's true.
Yeah, so that's we did all that all the stay-at-home orders and all the shutdowns and all those things were so we could flatten the curve enough that there was room in the hospital for you. And so I thought that was really good. I was like, yeah, right.
And not that we want anybody to
no, but
go to the
that's
hospital.
the point.
But, yeah.
I mean, that's the point. That was the point, to slow the vaccine or slow the virus down. I can't think today.
Sure.
Slow the virus down enough that we could catch up to it. Our supplies could catch up to it. Our testing could catch up to it. Our
Yeah, our testing, our PPE, all of that stuff.
all that stuff.
So
Yeah.
we do believe that we're at that point where we are able to accommodate more treatment and more patients. But having said that, we do know hospitals nearby that are nearing capacity. So, and this is in Southeast Kansas, and this is throughout the state. So, so really, for a county like ours, it takes all of a few people to start pushing our limits of what of the care we can provide to somebody with coronavirus. So
truly, what, 4?
yeah, really.
Like we had 4 people hospitalized.
And we talked early on that we don't have a lot of ventilators in Wilson County, and so that's if we start seeing rises in the numbers in the urban areas as we're seeing, and we keep people here in our rural areas to take care of them. There's only a few spots that we're and there's only a little bit of equipment to take care of people, and so not to scare people, but we can do it. We just don't. We don't want to have to, quite honestly. I mean, we want you to be taken care of the best that you can in the right places. So there was a question. Oh, Tabby, you might go back earlier in the video. We talked a lot about Casey, so we don't want to rehash all of that, but it's definitely there. And thank you guys for all the really really kind words. Thank you.
Yes.
This has been an interesting time.
It has been an interesting time, and we get comments on both sides of the board, but the support has been incredible. So we really appreciate it.
And we know that people are scared, and that's just what a pandemic does to people, and that's okay. We get it, you know. So we will plan on, in a couple of weeks, we will do this again. We'll let you know earlier if we're going to do this earlier time. You may put in comments whether you like the earlier time or the 5:30 time, but let us know. And we will try to keep on schedule, but it'll be 2 weeks from now. Unless anything else exciting happens in the meantime, we'll hop on a little bit early. Last thing, Rachel asked about breastfeeding. Can it protect your baby if you test positive via antibodies? I'm going to say, because we don't have the antibody testing that we know means that you are immune to coronavirus at this point, then we can't rely on antibody testing to tell us whether you can provide those protective antibodies while breastfeeding. Is that safe?
Yeah, I was going to say theoretically, but I've not read anything specifically about that.
Alrighty. We're seeing some like in the early time. I feel like this is the end of the day where people want to do something besides work anyways. I saw you, Denise. I know you're not working. Just kidding.
And my kid has a softball game tonight, so that's why we had to move it up. Sorry.
All right, you guys. Anything else, Des, that we might have missed?
I don't think so. We'll look into the MMR thing. I'm intrigued by that.
Yes,
we'll
do that.
I'm not sure.
All right. And as far as schools, sorry, I saw that comment about schools. We will try to keep people updated as well, but that really goes under the Kansas Department of Education, and so they're going to be giving the main guidance with that. I do know that that I am currently on a work group that is working with other doctors and pediatricians and family docs and people around the state who are trying to give guidance for schools, because we know it's going to be really, really tricky. Not everything is black and white. Wear a mask, social distance. We know, kids. We know what that means and how hard that is. So we're going to try to come up with guidance that can really help us keep kids in school, keep them safe, and then prepare for anything that we might come across as we get back into school.
Yeah, and I think the Department of Ed's guidance comes out like beginning to mid-July. So, and I know the schools are already working on how they're going to do things. Yeah.
All right. Okay.
All right. We're done.
Yay.
We'll see you guys in a couple
be
weeks.
safe, wear masks. All right. See you in 2 weeks. All right. Bye-bye.